Yeah.
Are you sure? Or are these
I think
the
PFT's
same?
is first and then maybe they're in the same week.
Is it not record?
If you want to move it,
Well, good luck with that.
Okay, wait, I have it. Right here somewhere.
It goes straight down this. Why are you recording?
Cause so we could remember it.
Okay.
Yeah, PFT's
Do you
this
see the
week.
instructions?
Yes.
Step by step. Yeah. That is what you're graded on.
Okay.
Yes, it's in a module. It's in our Care 21C, which is your clinical and your lab course. If you click on that, you're going to find a lot of information.
that's what I was missing. That's the key thing.
Does everyone see this? So
Yes.
we're going to go straight down this today.
Okay.
Okay, so an indication for ABGs is to identify where the patient is for oxygenation and ventilation status. Right on that.
On the floor?
She's recording, so she's going to share it with everyone. Also, if the patient has distress for unknown reasons. Okay. Also used to quantify intubation and mechanical ventilation. Contraindications would be what? Okay, good. So if they failed it on the right arm, where would we go?
Left arm.
The left arm. And if they failed that, what would you do?
Arterial.
Notify the doctor. Let the doctor do it. The physician's the only one who is allowed to do a femoral stick. Okay, say yes?
Yes.
Okay, so if a patient has a shunt anywhere on the right side, either from here all the way over to the chest area, if there's any shunt whatsoever on the right side, you can't do it on, you can't draw from the right. It's on the left, you can't draw from the left. Does everyone understand that?
Or a mastectomy.
Or a mastectomy. Yes?
What if it's a bilateral? If it's like a double mastectomy, meaning both sides are affected, you just have to have the doctor femoral stick.
Alright, so what if the patient is on a blood thinner, an anticoagulant? Yes, you can draw an ABG on those patients.
But then you have to.
Hold the pressure line. We're pounding.
It's ready. I had a little coffee. There you go.
Yeah. Jack, yeah, right?
Yeah, let's stick it.
Okay, so what's a hazard?
Hazard would be bleeding out.
Poking yourself. Okay, that's
The
Not
patient
stopping bleeding.
Yeah.
Not stop bleeding.
Not being
okay,
able
so
to
they're
stop.
not clotting.
Not clotting.
Okay.
Not clotting.
What else?
Anxiety.
Artery laceration.
Ooh, artery laceration. Yeah. Well, yeah. I mean, yeah.
That means
Makes sense.
you have gone in and let's say you didn't get the ABG and you've moved it, the needle around, you are now slicing and dicing that artery.
Slicing and dicing.
Ooh. How do they repair that? How do they repair it?
They do those tiny little stitches. Just okay.
Wow, that's a side of you I didn't see. What did you
Pray.
say?
I said throw the whole arm
You gotta start over now.
Pray.
I see that in her personality.
Oh, goodness.
I know you were. Yeah. Okay. Spoken like a true medical professional. Oh, that way
You just made her proud.
Because think about it. The artery is coming down this way to feed the hand.
Yes.
And if you've lacerated this, what's going to happen?
The hand's gonna not
Yeah.
get.
You're going to bleed out. It's going to, I mean, most likely they will not die because they're in the hospital. They're going to rush them down to surgery and they're going to laser it.
Mm-hmm.
Laser it closed.
So yeah, cauterize it?
Mhm.
Oh, shoot.
Laser it closed. That's crazy.
that's all bad.
then you're
That's
not,
all bad.
so you're not supposed to like try to like go
Get
in.
fired.
There's a
'Cause I've seen people do
specific,
that.
there's a specific technique to do that safely. And Diana's a real hag about that. Even when I used to work out in the field, I'd be like, don't do that. What are you fishing for? You trying to kill him? Yeah, I'm a nice person. So, you are to wash your hands, put your gloves on, and explain the procedure to the patient. What's a good way to explain it to the patient? Yo, dude, I'm here. I'm gonna stick this needle in you. You won't feel a thing, but don't move because you could bleed out.
No.
So,
What are you gonna say?
Hello, Miss Smith. My name is so from respiratory.
The doctor ordered a ABG. That is where we have to draw blood from your artery. And
check the.
Can we just say, oh, I'm just gonna draw some blood, or do we have to tell them it's from the artery? Because it's gonna give them anxiety.
I have to draw some blood. You're gonna feel the prick, but I need you to be very still while I draw this.
Okay.
And if they say why, I am drawing this from the artery.
Okay. Because if you go in and be like, oh, I'm drawing from your artery, then be like, oh, wait, what?
Yeah, I'm gonna stick it right in your carotid, right in your neck. Okay, so before I even do the modified Allen's test, let me rephrase that. I do the modified Allen's test, right? How do you do the modified Allen's?
You hold on to the
girl.
radial.
Okay, I want you to make a fist, pump it, pump. Okay, hold your fist, hold, and release your fist.
There you go.
There you go. So positive, nice and good. So then, this is all good. I'm gonna take a towel or a pillow and I'm gonna roll it up under here. That way his wrist should fall like that, nice and easy. Right? Have my gloves on. And then, and you can do this ooh, I definitely don't want that one. And you always start in the center, if where I palpated the pulse, and I'm gonna work my way out. Everybody see that? Okay, that's trash. Now, you have to have your Band-Aid ready. I don't have a Band-Aid because I work in the lab in college. Did I just say that?
Nothing.
Love it. Now, this is supposed to be sterile, or as clean as possible. So, when I am at the hospital, these will come in a little sterile package. They will not be in this, they'll be in a sterile package. And you're gonna open it up, but leave it in the package. Did everybody hear that? So this is in the sterile package. It is laying nice and neat. It's all happy. Okay, so I've got my Band-Aid. I've got my super duper sterile gauze there. And I opened up a new one because I'm gonna need college and I'm gonna get wasted. So I'm cleaning. What am I doing with this finger?
Cleaning your gloves after you palpated.
So what? Because I just cleaned this, right?
Yes.
Some of these, it depends on the brand or where you work. This needle may be pulsatile, meaning that it will move back when it feels the pressure of the blood. Others, you may have to pull back a little bit and allow it to fill up before it moves the plunger. So how do I know which one you're going to be exposed to? I don't. Okay. So this down and I palpate it, correct?
Mm-hmm.
See the bevel? Do you see that bevel? Everybody know what the bevel looks like?
Yeah, yeah. The little hole at the
Yes
end.
or no?
Yes.
Okay, so that is the part that must go up. Now, I've uncapped my needle, and what I do with my little rubber thingy, there's my rubber snubber. I have this out. You ready? I'm not gonna stick it. I want to, but.
I want to.
So what am I gonna do? You hold this like a pencil. It's a firm but gentle grip. Bevel up, correct? I got it in my hand. Palpate. And what I do is I put the index and the middle finger down, palpate it. Okay, relax your wrist, it's okay. Oh, you got nervous.
Make it faster.
It started getting faster and real.
Aww.
Okay, I'm not gonna stick it, but I'd go right underneath my middle finger.
Okay,
Mm.
underneath.
Okay, do you see at the angle I'm at?
Yeah.
Okay, so let's say that it has gone back to 1 mil. You want at least 1 mil. Okay, what am I gonna do? I have it in his wrist. Okay, in the artery.
Okay.
It's gone up to 1 mil, and I say, don't move. Don't move, you're doing good. I take this, and as I pull this out, I'm putting this down.
Pressure.
Okay, and I'm holding pressure. I have to immediately put my needle in this, or whatever contraption they have.
Tap it.
What am I doing?
Tapping it to get the air bubbles out.
Tapping to get the air bubbles up. Then what? Hopefully he's of sound mind. Hey, can you hold pressure right there? Right there. Don't hold it. Hold it like you mean it. Okay, there you go. Okay, take this off. Expel the air bubbles. Put this on. Okay, everything looks good. How are you doing? Let me see this. What's going on in here? Yeah. You well, lay down. Okay.
Doctor, I don't know what happened.
So you have a choice. You can either throw this away and get another one. Okay, is usually what I do just because it makes the patient feel better. Okay, I'm going to fold it because Dinah's like a neat freak when it comes to things like that. And then I'm going to take my handy dandy Band-Aid, which this is a long Band-Aid, isn't it? Ooh, doggies. There you go. And you love it.
Okay.
Okay, now give that like 2-3 minutes and you'll be all right. Okay, then you have to put the patient label on here. You have to date, time, your initials, and the FiO2%. They don't want to know that the patient's on 2 liters. They want to know the percent. So if they're on 2 liters, it's 2 times 4, which is 8, right? Plus 21 equals 29%. Is that correct?
Mm-hmm.
Yes, that is what you have to put on there.
2 liters.
Everybody got it?
Is that how you're going to send it to the lab? The syringe or
The syringe would go like this in one of the white, red biohazard bags. Depends on the hospital. Some places say you don't need to put it on ice unless it's going to be out for over 15 minutes. Some say just put it on ice because we don't know when lab's going to get to it. Well, if I'm in ICU or I'm on a floor that has an ABG machine, I'm going to take it straight there and run it.
VA has the handheld, they just like directly put the blood in.
So do you know if it's an iStat or a, oh, what's the other one?
They used to put the ice.
So like inserted in this.
Irma. Irma's
so,
another
like a
one. They
little
have
chip.
iStat and Irma. I know, that's just the name of the brand. Just tell me. So when you find out the name, you need to let me know.
So I used to work on West ICU, neuro ICU, and I would always see it, but I didn't know what it was. And then I think the R tubes will actually leave them pop up when they're done, or like they just leave it.
Oh, that's lazy.
Yeah, I was like I always
Like,
walk
so they
past
run
it.
the ABG and then they just leave the.
Yeah, it'll be there all day, and I see it, and then I'll come back and I'm like, I'll go up to my nurse and be like, should I throw this away, or like it's
Yeah.
blood right here, or like I was like, I don't know.
Okay, so let me show you. You guys just chill. Let me show you something else. Stay there.